Nearly 500,000 low and middle-income people in Canada have now seen a dentist through the new public dental care plan. This summer, it was supposed to start covering adults living with disabilities, but the vast majority don't qualify because of complicated paperwork. Advocates say it's just one more hurdle disabled Canadians have to deal with. Marina von Stackelberg explains.
I can't describe just how anxiety-inducing these processes are for people like myself.
Kevin Cunyu spent years fighting to receive a mental health and chemical sensitivity diagnosis. After many doctors and many forms, he now qualifies for Ontario's Disability Support Program. But that's not good enough to apply for the new National Dental Care Plan.
What more proof does the government need?
That's because Ottawa has decided to use its own disability tax credit to decide if someone is, in its eyes, disabled. So now Cunyu has to apply for that before he can even apply for dental care. His dentist has told him the insurance he just started to get through Ontario's disability supports will only continue if he's rejected from the federal program. So for now, he has no dental coverage at all.
That is extremely concerning to us.
Advocates like Michelle Hewitt with the group Disability Without Poverty say the tax credit was never meant to be a marker for who needs support, and Ottawa shouldn't be using it to decide who gets dental care.
They see it as the easiest list that they can have of disabled people that are severe and very severely disabled. But it's such a hard list to get onto.
Case in point, the vast majority of Canadians with disabilities don't even receive the tax credit. Hewitt says more than 1 million severely disabled Canadians should be eligible for dental care. Yet Ottawa only estimates it will cover a fraction of those people who get the tax credit, less than 200,000.
It's one of the most burdensome application processes for any federal benefit.
Green Party MP Mike Morris says one of the biggest issues, the tax credit requires a brand new medical form, even if the person's doctor has already filled out extensive forms for other disability programs. Another massive hurdle for people like Kevin Cunyu.
I think that the government should find a better way. This should not be the responsibility of people suffering from sometimes debilitating conditions that make these sorts of, bureaucratic hoops absolute nightmares.
Ottawa has promised to spend several $100 million to pay doctors to fill out the medical forms. Canada's Health Minister Mark Holland acknowledges that using the tax credit means some people will be missed. He says many of them will be included next year, once the program expands to cover all low and middle income Canadians. Marina von Stackelberg, CBC News, Ottawa.